Fight Club by Ampojwalam, Rahman, and Patrick Kimball.
So the general synopsis of the film is that the narrator, or Tyler Durden, which is played by Brad Pitt, is a middle-aged man with an office job that he doesn't really like or enjoy, who realizes that he wants more than what his life currently offers. So he creates this alter ego or other personality. Tyler is the narrator, but with a different identity that is better in every way, allowing Tyler, or the narrator, to achieve all the goals that he really wants to do. The setting is basically just a vague consumerism-driven city, which is pretty much the idea that the film can happen everywhere. So fight clubs actually spring up in all of these different places.
The disorder he has is called dissociative identity disorder. Two or more distinct personalities alternately control Tyler. Tyler may or may not be aware of the alternate personalities. Individuals often have severe gaps in memory, depression, anxiety, sleep issues, and suicidal thoughts or actions. This is often caused by some previous trauma. In the movie setting, the movie takes place in a modern American society, so it's likely that the narrator would have been properly diagnosed had he gone to see a therapist. In different cultures, dissociative identity disorder is described as supernatural possession by spirits or demons, so diagnosis differs due to superstition or spiritual beliefs rather than actual science. However, people of all cultures and backgrounds do experience dissociative identity disorder. Our culture, however, tends to oversimplify the disorder and assume that it is less involved and more easily controllable than it really is.
Okay, so the symptoms we actually see in the movie is that the narrator shows clear signs of insomnia, depression, suicidal thoughts, and memory gaps. The protagonist, rather than sleeping, would perform the actions of Tyler Durden. So basically he was sleepwalking. He didn't get much rest. While he was sleeping, or the narrator was sleeping, he was actually Tyler, doing all of the things for Fight Club and Project Mayhem. The protagonist was addicted to support groups in which he did not belong. Example is he went to a testicular cancer support group even though he didn't have it. An example of memory gaps is that one of the major characters in the film, Marla, becomes Tyler's lover. However, the narrator can't remember the experiences that Tyler actually has with her. So in order to get rid of Tyler at the very end of the movie, the narrator shoots himself in the face, which is fairly representative of a suicidal tendency.
An unseen symptom that the narrator has is abnormal amounts of anxiety, panic attacks, or flashbacks or triggers. This only occurs once, when the narrator realizes that he has the disorder, which would probably make anyone a little anxious. Other than that, he doesn't exhibit any signs of anxiety or panic attacks. We also do not observe any alcohol abuse, drug addiction, or eating disorders.
So our plan for treatment is psychotherapy because it's the most common and effective option for treating dissociative identity disorder, with the goal of uniting the personalities into one person. Additionally, the technique of hypnosis is often used concurrently with psychotherapy to bring the patient to an altered state of consciousness and allow the psychologist to actually observe the different aspects of the subject to begin the process of combining them. Drugs are not used to directly treat the disorder, but they are often prescribed to combat some symptoms.
Ethical and external aspects of treatment. Because psychotherapy is not an intrusive or disruptive treatment, it is the most ethical way to treat dissociative identity disorder, provided that the patient is willing to undergo the treatment. People often deny that they have a disorder in the first place and refuse to seek treatment at all. Improper diagnosis would lead to incorrect treatments. If a superstitious culture performed an exorcism, the subject would not get any better.
And lastly, broader perspectives. Fight Club portrays the dissociative identity disorder with a fair amount of accuracy. Many of the common symptoms are present, and the perspective is correct with respect to the memory loss and lack of awareness often associated with the condition. However, even in present-day psychology, this disorder is not fully understood and varies drastically for each case study. Most of what we see in movies forms our stereotypes for what we believe a disorder is in all cases in real life. For example, it is easy to generalize schizophrenia as people who are dangerously at odds with reality, like the Joker in Batman movies, despite the fact that the disorder is a spectrum.
Thank you for your time.